Chapter 15 is going to be on the nutritional requirements for older adults and the eating habits that affect their oral health. This starts in your book on page 285. So the most common nutritional disorder is going to be obesity, and it will contribute to common chronic diseases like diabetes and cardiovascular disease, and even things you might not think of like lung disease, arthritis, and Alzheimer's disease and other dementia. It's going to exacerbate age-related decline in physical function, and it could lead to frailty. This malnutrition risk is going to be seen in people who have less education and lower income, individuals who are housebound, especially if they live alone and they rely on an individual to come by and help them. If they have some type of physical disability, they might not go many places. If they are struggling with depression or other mental health issues. So yes to like dementia, but also individuals who are older end up getting depression easily because the people they know or the people they grew up with have died. And then a big drastic change too, like the death of a spouse, is going to put them at risk for malnutrition. So as far as aging, as the individual gets older, their body is less able to correct nutrient imbalances, like when they need to increase absorption because the intake is decreased, right? Well, as the individual ages, that doesn't happen. And so the precarious physiologic balance may be upset, which can either cause disease or maybe the disease causes the nutritional imbalance. And let's move on to the oral cavity, which is the slide we're on. So oral cavity, the oral health issues, including chewing, swallowing, and mouth pain, are indicators of risk for malnutrition. Changes in taste and smell are going to play a role and are going to increase the amount of carcinogenic food choices. The reason for this is they make their foods like really salty or really sweet because otherwise they can't taste it. Xerostomia may lead to avoidance of crunchy, dry, and sticky foods, right? So they're only going to want to eat maybe hard candies that will help to stimulate their saliva, and that's going to increase their caries risk as well. Periodontal disease increases the likelihood of weight loss. The reason for this has been like the number of teeth that you have. So it shows that many individuals in the U.S. have who are older than 60 only have 19 teeth. So it's going to be pretty difficult to eat and chew a lot of good foods if you don't have any teeth. The quality nutrient intake decreases as the number of teeth decreases. So studies have found that people with fewer than 28 teeth had a significantly lower intake of fruits and vegetables and lower serum levels for beta-carotene, folate, and vitamin C. A Japanese study found that the total protein, animal protein, sodium, vitamins D, B1, B6, niacin, and pantothenic acid were associated with the number of teeth. Also, their gastrointestinal tract is going to play a role, so there could be changes in their esophageal motility, right? They have a hard time swallowing. This is also going to play a role, like if they don't have as many teeth, they're not going to be able to chew their food up as well, and that means they're going to be swallowing less chewed up food, which is going to either get stuck in their throat or their stomach is going to have a really hard time breaking it down, right? And it could make them eat, not only slower, but also to not eat enough food because they just don't want to. Diminished hydrochloric acid secretion may affect absorption of calcium, iron, and vitamin B12, and then constipation may result from that altered gastrointestinal motility and they benefit from fiber-containing foods, adequate fluid intake, and physical activity. So those are the three things that they need in order to sort of combat this gastrointestinal tract issues and the issues with motility. some of the other issues that they deal with are going to be their hydration. So often we see a decrease in how thirsty they are, which means they drink less water, and that means that they are very predisposed to become dehydrated. There are certain chronic illnesses like heart and kidney disease that lead to the impairment of homeostatic mechanisms controlling fluid balance. Also, we have to think about how many medications these individuals are taking and how those play a role. Like if they have hypertension and they're taking a diuretic, then that's going to play a role in their hydration status. Unsurprisingly, older age is going to play a role in their musculoskeletal system. So bone resorption progresses rapidly in the older patient. Typically after the age of 45, lean body mass declines up to 0.4% every year, and adipose tissue increases. So inactivity is responsible for the loss of muscle strength and balance, and may predispose the individual to falling. So the less active the individual is, the less muscle they have. And then not having muscle is muscle use is one of the things that helps to stimulate bone growth, right? So if you don't use it, then the bones resorb. And so if your bones are resorbing and you also aren't using muscles and strength in balance, then when you fall, you could very easily fracture a bone. Sarcopenia is the reduction of skeletal muscle mass and replacement by fat that occurs in older adults. Sarcopenia is not a given. It's not something you have to deal with as long as you, these days the recommendation is to do weight-bearing exercises. And then maintaining muscle is essential in reducing the risk of falls. And that's a pretty straightforward balance between muscle, like weight-bearing exercises, having muscle mass, which helps to keep your bones healthy, which if you do fall, then you don't hurt yourself as much. And then a decline in lean body mass results in declined basal metabolic rate, right? So the less muscle that they have, then they don't burn as many calories. So as they age, if they don't have as much muscle, then they don't burn as many calories, which means if they eat the same number of calories, they'll gain weight. There are a lot of factors that are going to influence older adults. And the first one is going to be socioeconomic factors. So if you've ever heard an older individual say, back when they were a kid that bread costs 10 cents, that's inflation, and that's what they're dealing with. They could be dealing with failing health, medical bills, cost of medications. Medication is very expensive, and if they're not on like a good medical insurance, then they could be really struggling with something like that. Title III nutrition programs for elderly. This is kind of that congregate dining and Meals on Wheels. Those are usually available to older adults, but it really depends on where they live. If they don't live in an area that has, the route for Meals on Wheels, then they're not able to get it. And then psychological factors predispose to decreased appetite and interest in food. So apathy and depression. Your book is the slide prompts me to say that loneliness is related to dietary inadequacies. So it makes me really sad thinking about older people and how their friends die. So as the individual is older than 51, they get a revised dietary reference intake. You can find this on page 292 in your book. This is table 15.1, and it goes through the differences of men and women for the ages 51 to 70, and then anyone older than 70. Metabolism to maintain body functions requires all the same nutrients, but the requirements for more micronutrients are increased, and then the overall kilocalories needs to be decreased. So as far as the energy and protein requirement, their energy balance of course, is recommended, right? So the number of calories they eat should be the number of calories they burn. Weight loss is not necessarily going to increase lifespan. So just because someone is going to lose weight doesn't necessarily mean they are healthier and will live longer. Calorie needs will decrease with age, but protein doesn't, right? Because the older the individual is, the more that we need to replace some of the deteriorating cells. It sounds horrible every time I think about that, but they need just as much protein in order to replace cellular structure. And then protein needs are proportional to body weight. So, a heavier individual needs more protein than someone lighter. Approximately 25 to 30 grams of high quality protein will maximize muscle protein synthesis because we want to maintain muscle mass, lean body mass. Approximately half of adults over the age of 50 are going to fail to meet the recommended dietary allowance for protein. So that's just something to keep in mind. So vitamin D intake is going to be higher for adults as far as the recommended amount. So between the ages of 51 to 70, they recommend 15 micrograms a day. And then as they, 70 and older, they recommend 20 micrograms a day. And then 30% of persons aged 60 and older in lower latitudes have vitamin D insufficiency in the winter. So this is people who live in colder climates, and it's basically they don't go outside in the winter time. They stay inside, and they will typically have a vitamin D insufficiency. 10 to 30% will have a reduced absorption of vitamin B12. The requirements for folic acid, vitamin B6, and vitamin B12 are increased in order to prevent decline in cognitive function and reduce risk for coronary artery disease. Sometimes the neurological symptoms that present are going to be similar to dementia, but they could be caused by a deficiency of vitamin B6, vitamin B12, and folate. Although it's kind of marginal. Usually at that age it is dementia, but it's important that if the individual is starting to have signs of dementia that they get their blood work done. And then intake is reported to be, economic factors and chewing problems may negatively affect meat consumption, thus negatively affecting vitamin B6 and vitamin B12 intake. So these are great people to recommend. If they can't chew up steak or chicken or whatever it is they want to chew, then you might recommend a easier to palate source of protein. I always recommend beans, and I mean they're protein, they're fiber, they're phytonutrients. Beans are like the best thing for everyone to eat more of. As far as calcium goes, the adequate intake is going to be 1,200 milligrams, higher than for younger adults to maintain bone mass and reduce the risk of osteoporosis. So while they might not be absorbing more, they want to make sure there's enough calcium in the diet that they are getting all of it they can absorb. There's going to be decreased physical activity, which is going to contribute to the loss of bone density. Obviously, less muscle mass means less bone density. The more muscle mass you have, the more bone density you have. And then sodium intake does need to be adjusted based on physiologic condition. So people who have hypertension or congestive heart failure, they need to watch their sodium intake. Aging can negatively affect the absorption of magnesium from foods, and the kidneys may increase excretion. So many older adults have a pretty poor diet. And so 1 in 4 older adults consume fewer than the recommended servings of meat. Dairy products, fruits, and vegetables frequently are lacking in their diet, especially for those living alone. The routine consumption of milk is difficult because of its expense and the frequent trips to purchase it. I don't know if you guys have hung out. I was actually living with my grandparents when I went through hygiene school, and it was interesting to go to school and learn these kinds of things and then go home and look at them and be like, oh, that's what you guys are doing. But they would buy foods that were more shelf stable so they wouldn't have to go to the grocery store as often. And then choice of soft foods will usually result in a decrease in protein intake and intake of more simple carbohydrates. So this is, a lot of those processed foods and things like that. They'll fill up on like breads and stuff like that, and then they won't get as much protein, and also they have a higher risk of cavities. Also, you have to think about like financial issues, like especially if they live alone and they don't work, then they're probably living on a very limited income. And so they may not be able to purchase very like high nutritious foods. But some of the most nutritious foods are, not only shelf stable, but they are pretty inexpensive. So like beans and like whole grains and things like that, when you buy them in bulk and dry, they're usually pretty easily affordable. And then seniors are at their highest risk of consuming minimal amounts of fruits and veggies are those that are usually socially isolated. So they might be individuals who are missing pairs of posterior teeth, so they can't chew those kinds of foods, and they have poor self-reported health, or those who are obese. As far as eating patterns still going for older adults, the snacking and nutritional supplements. Snacking is a good thing. So, you don't want to snack when you are just a regular adult, but as an older adult, you may need to. In order to consume adequate amounts of calories and protein, you want to choose healthy snacks that are like cheese, hard-boiled eggs, low-fat milk products, bananas, and canned fruit can be recommended. I don't know if I would recommend canned fruit, but milk-based food supplements like instant breakfast mix are economical, and they can help prevent nutrient deficiencies. And then also they're pretty shelf stable. And then commercial liquid nutrition supplements like Ensure are going to be pretty convenient. So if you have an individual who has a hard time chewing things in order to get enough protein into them, you might give them something like that, like a already mixed and made and ready to go kind of protein shake. So individuals who do eat more of the fresh foods have to be careful of foodborne illnesses. Obviously, just like everyone has to be careful of foodborne illnesses, they may have a compromised immune system, which means that they a couple of germs that you or I may not have a hard time fighting off, they will. And then decreased hydrochloric acid in the stomach, which means it means that their stomach isn't quite as acidic as it should be, and they're not able to kill some of the bacteria that they eat. This can lead to something called SIBO, which is like a bacterial infection of your small intestine, and that can be pretty horrible. And then lessened senses of smell and taste. So, if they aren't able to smell or taste, then they might eat something that isn't quite as fresh. They might have bread and not notice that it has mold on it or something like that. So older adults are a little bit more susceptible to food poisoning than younger adults. All right, so as far as the dietary guidelines and the My Plate, the recommendations are to eat more whole grains, vegetables, legumes. Hold on, let me draw on this. To eat more whole grains, vegetables, legumes, fat-free or low-fat milk, and food and beverages lower in sodium and added sugars. So stay away from sodium, stay away from sugar, and eat more whole foods. And then updated version of My Plate for older adults focuses on unique needs for aging process. So it's a little bit more tailored for older adults. If you turn in your book to, let me find it, it's page 296, that has the My Plate for older adults for you to be able to see how they're a little different from the regular My Plate. And then that eating should be an enjoyable routine. People are more likely to follow plans that they find enjoyable. And so if you can kind of positively associate eating healthy with something that they enjoy, then you'll be able to get more of a habit forming from it than if you are like suffering cooking and then you try to make it a habit. And it's never too late to make healthy changes. It's never too late to eat healthier and feel better. All right, so as far as when selecting those foods that they recommend older adults to eat, they tell them to buy a variety of fresh foods, especially. Fresh food is going to be, sometimes it's the most healthy, sometimes it's not. And then frozen, fresh and frozen sometimes pass the meddle back and forth, because sometimes fresh is the most nutritious way to eat it, and then sometimes frozen is the most nutritious way. And this is because when they freeze a lot of produce foods, they will pick it at its like most perfectly ripe time, and it freezes, they like flash freeze it right there. So then when you eat it, you're getting all of those nutrients like perfect. But then with fresh, sometimes they'll pick it when it's at its most ripe, and then by the time it travels to the grocery store where you are, and then it sits on the shelf for a couple days, and then you buy it, and then you let it sit in your crisper for like 4 days, it might not be the most fresh, right? So sometimes frozen's a little better. That went off on a tangent. Sometimes fresh is better. Anytime you can get no salt added with your veggies and fruit that is packed in its own juices is going to be better for you than the ones that come in like the like sugar or whatever liquid. Choose reduced sodium varieties of beans, salad dressings, and baked products anytime you can. If you're going to buy whatever it is, or you can choose, to make it at home. And then dried fruit and unsalted nuts make good portable snacks. And then to be careful in restaurants, because, as we learned before the midterm, that most of the time restaurants will contribute a significant amount of salt and added fats to the diet. Okay, so as far as supplements go, there is calcium less than 2,500 milligrams per day, and it should be taken in 2 600 milligram doses. So you don't want to take too much calcium. And then vitamin D, they recommend taking less than 400 IU a day. Vitamin B12 is the recommend is 2.4 micrograms. Omega-3 fatty acids, as far as people who do not eat fish at least weekly, can benefit from a fish oil supplement. As many as 70% of older adults will take dietary supplements in order to maintain a healthy life or prevent disease, because they know that that their eating patterns aren't ideal. Or maybe because a healthcare professional has recommended to them, maybe like, hey, you should, your vitamin D is low, so then they start taking it. Age-related macular degeneration is a deterioration in the central area of the retina, which causes lesions that lead to the loss of central vision. For the most part, vision is one of the things that everyone deteriorates. It's not just some people do. Everyone's vision deteriorates. Okay, so this is the end of chapter 15, and it is the end of week 7 lecture.